Since I was a child, I always wanted to do, and I challenged myself again and again and again. When I was 20, I had my own dance studio in Jerusalem, and 4 years later, I choreographed the national opening ceremony of the Independence Day, which was broadcasted live on TV. I wanted to learn how to surf. I had to dare myself to go into the water and take those big waves, and I did. Hi, I'm Dr. Abigail Livny-Ezer. I'm a neuroscientist, neuropsychologist, and neuroimaging expert, a member of the Talpiot Excellence in Biomedical Research Program. I'm at the head of the Diagnostic Neuroimaging Laboratory. I believe MRI scans analyzed with our unique image processing and artificial intelligence algorithm will change the way the neurology and psychiatric fields work today. I opened a neuroimaging laboratory at Sheba Medical Center. I built an amazing team to develop image processing, neuroimaging analysis together with AI algorithms. During our research, I challenged my team to offer our algorithms as service to the hospital to aid neurosurgeons define their path of brain surgery. My research is all about changing the way we diagnose and treat brain disorders patients, and that's what I'm here to talk about.
Please welcome to the stage Dr. Abigail Livny-Ezer.
I would like to tell you about two of our patients. The first one is Gali. Since COVID, she has lost the desire to go out of her home. Recently, she quit her job and dropped out of her BA studies. Gali was diagnosed by a psychiatrist as suffering from depression and was prescribed with antidepressant medication. But few weeks later, she still felt like there was nothing worth waking up for in the morning. Dan, the second patient, climbed on a chair to change a light bulb in his bathroom. He fell and hit his head on the bathtub, lost his consciousness for a few seconds, and woke up to a terrible headache and blurriness. Dan was examined in the emergency room by a neurologist and performed a brain CT scan, which did not detect any brain abnormality, any bleeding, and Dan was diagnosed as suffering from a concussion. Gali and Dan were recruited to participate in my studies, and both patients performed a brain MRI scan. What is the common thread between these two patients, aside from participating in my studies? Well, let's have a look at their brain scans. They look normal. The psychiatrist, neurologist, and neuroradiologist did not detect any brain abnormality, and their scan reports were defined intact. But I ask, is this true? Are the tools we have today sensitive enough to detect specific brain diseases? As every person has his unique facial characteristics and unique fingerprint, so does every person has his distinct brain neural print, a concept called the connectome, which is a map of the individual's specific brain connections. Imagine what if certain brain diseases, such as depression or concussion, had their own specific connectome. Our vision is that we could learn the specific pattern and unique neural print of a particular brain disease by looking at patients' personalized connectomes with artificial intelligence. In the field of brain diseases, in particular in neurology or psychiatry, there is a lack of tools for objective diagnosis, outcome prediction, and personalized medicine. Therefore, we developed a system in which a patient with a query of brain disease will perform a short MRI scan. Our system will then produce the individual's personalized brain connectomes, insert it into our special machine learning artificial intelligence model. That in turn outputs a diagnosis, predicts clinical outcome, and recommends optimal treatments. So, how does our system work? MRI can be used to scan both structure and function of the brain. Structural MRI scans follows the pathway of our neurons, creating a map of white matter tract which connects one area of the brain to another. This is the structural connectome. Functional MRI scans follows brain activation. Mapping the joint activity between different brain regions forms the functional connectome. The use of the two types of connections in our system is of great importance, since the multimodality aspect is imperative to get a comprehensive view of the brain. Imagine a diagonal line on this image. Looking from one point of view, one can think this is a horse, and from another, a person. But only the combination and integration of the two perspectives will give us the full, true picture. Remember Gali? Using our system, we were able to diagnose Gali and other individuals suffering from depression with an exceptionally high accuracy of 88%, something that the physicians or any other medical tests were not able to do even on the basis of these patients' brain scans. After Gali's MRI scan, she was prescribed with antidepressant medication, and we followed her and other depressive patients for 8 weeks, the time it takes to feel relief in symptoms. Based on our pre-treatment personalized connectome, we were also able to predict which depressed patient will respond to medication 8 weeks later with a high accuracy of 91%. Again, incomparable to the standard today. This time, the medication Gali received was a good fit. She responded to the treatment we recommended her based on her connectome. Most patients aren't that lucky, since only 1 out of 3 patients will respond to the first line of medication. Our system will allow us to guide physicians to prescribe the best fit medication for each patient from the start, thus preventing prolonged suffering. What about Dan? We were also able to diagnose Dan and other patients as suffering from concussion with an extremely high accuracy of 93%. The interesting thing is that when looking only at the structural or only at the functional connectome, we received lower accuracy rates than from using the multimodal connectomes, emphasizing the integration of both brain structure and function. Dan, like other concussed patients, was at high risk to suffer from cognitive deficits post his head injury. So we clinically followed him and other patients for a period of a year, and were able to predict clinical and cognitive outcome of these concussed patients a year post-injury. Thus, based on our prediction, we could recommend cognitive intervention for a more optimal treatment. On a personal note, a few months ago, my brother-in-law called me after he had an accident during riding his bicycle. He hit his head badly and was on his way to the emergency room. I was shocked. He was on his way to a different big hospital, not Sheba. So I urged him to immediately change his destination to Sheba, of course, and met him there. After both the neurologist and radiologist examined him and his CT brain scan, I was assured he is okay, and he was discharged. The next morning, he called me and said he had the worst headache ever. He was confused, and he was disoriented. I rushed him back to Sheba, worrying that we missed a hemorrhage in his brain. This time, we scanned him with a standard clinical MRI scan. And again, I was reassured his brain looked all good. Sure enough, our novel system recognized him as a concussed patient and not as a healthy participant based on his connectome. So, then what next? Almost every person knows a person who suffers from a type of brain disorder, such as Alzheimer's, pain disorders, post-traumatic disorders, or even ADHD. Our innovative system can be used as a platform for diagnosing and personalizing effective treatment of these and other neurological and psychiatric diseases. As Albert Einstein once said, a great thought begins by seeing something different, with a shift of the mind's eye. Thank you.